Listening to the brighter side on Z101.9 FM. I did promise you that today on the Know It segment, I'm not going to be talking alone. I'm going to be doing this with certified massage therapist. His name is Ransford Afari. And he's looking all fly in the studios of Z101.9 FM. And what are we talking about today? We are looking at the connection between depression, stress, and massage therapy. Well, Ransford says there's a connection, and he is going to explain that right in this row. I'm going to put him on the spot right here. Good morning to you, Ransford. How are you doing?
I'm good. Good morning.
Hey, even the voice was yeah, I'm good this morning. You know what I'm saying? Well, when you look at his abasa, I said, well, pump here. But you know, I'm wondering, Ransford, with all this bole now, if you massage someone as small as me, send me woo.
So you deeper pressure into your tissue and teeth.
Really?
It's just a matter of knowing what to do at a given time.
Okay, so
they come to drain us because of their body mass index.
Because of their
body mass index. We go about soon. We also are on soon, so the body are very tough. So I think the mechanism.
So if somebody comes with a bigger body, they give you stress.
Sometimes it's even easier because they may be big, but they may be softer. Like
well, you've met big and pugnacious ones before.
Yes.
And how do you handle that?
The only thing is that you do a very good job, but you wouldn't be able to charge them based on their body, right? Or ask for more, otherwise then there will be confusion. So even though we as massage therapists wouldn't ask you to send us a picture to know your BMI, because they think it's unprofessional. Obana say ube drain your body kwa na you lose kwa ube drain your energy no kwa na you lose.
So why don't you charge according to BMI?
I don't think it's the done thing, because
of course I'm just
nobody goes to the hospital telling the doctor say me soon but at the end of the day we as allied sciences would have to conform to the ethics of the health industry.
So when you finish massaging such, you say dear, we don't have body.
Yes.
But when you finish massaging such, what do you do to come back, to bring yourself back?
We as massage therapists also get massages because we always have to be in tip-top shape. We like to go to the gym and exercise. We like to climb the hill to us as well, So all the time we have that positive energy to melt yours down so that at least you come and then restore your lost energies.
I see. All right. So let's get straight to the point now. Okay. So what exactly is massage? Massage, I only said, stamp on my back with your foot.
By definition, massage is a systematic, and scientific manipulation of the body, the tissue. The therapist will have to apply their hands on your body, knowing the depth at which they should go to melt the knots. Knots are trigger points or tensions in your body, just so there could be cohesion of the blood flow. So where there is no blood flow, there is no energy, energy and nutrients. So your body requires, consistent blood flow for places not to be numbed and tensed. So when you work and you keep working and you are having wrong posture and accruing stress, it is incumbent on you to know, say, okay, even though out of the 7 days you are asked to rest a day, you should also add certain lifestyles as embracing massage therapy to get massages and be able to sleep and sleep better. Because you could also go to bed and then not sleep well. You understand?
We'll talk about the benefits of massage, but we are in the studio here with certified massage therapist Ransford Afari. We are looking at depression, stress, and massage therapy. Okay. What is the link between or among them? We're also live on Facebook on ZFMGH, so you can check us out over there. A very, very salient point you're making right there. So you're talking about crystals, okay, when you say tension in the body. Yeah. What causes that?
Oh, okay. So because you would have to work, definitely you would be doing certain things wrongly. Even the way you think, because God in his wisdom created us, gave us a mind, body, and a soul. Obi man tried and said, "Adriana anyejuma body no bread." So out of the hard work you're working on, there will be movement and then placing of or lifting of stuff near there. So at the end of the day, when there is not a perfect flow, places will be tense, it will be numbed, You know, massage has no nationality, but then in Ghana, people say it's un-Ghanaian, it's not our nature or our culture to get massages.
We'll talk about that because, you know, we need to be open-minded as well.
Yeah.
But Ransford, so what about those who say, I woke up this morning, I've done nothing. For 2 days I've been resting, and yet my body hurts. I'm not okay. Because you're talking about massage.
It could also be the kind of massage mattresses they lie on. You know, the education is not out there for us to know, say, if you have a king size bed, you are supposed to maybe change it after 3 years or 10 years.
Really?
No, I'm just saying, you know, the education is not out there. I don't even know, you know. So if I'm pampering my children to sleep and I lay at a certain point and I have them put their head on my chest, I'll realize that when I'm able to drift them to relaxation state and I'm getting up, you see the density would have to maybe take time to come back to its original state. So how many years is it right for you to change your mattresses? So you could spend the whole day in bed, but yet you probably might not have a very good sleep because of the way you slept, you know. And, you know, like I'm saying, the education is not out there. Do you sleep on the side? Do you sleep on your, you know, on your belly or on your back? You know, what pillow is correct pillow for you? Because at the end of the day, no because we're done the console. So now, and yet the other way around.
That's what came in my real who a brand here be a friend DJ Wade. He came to work one day, his neck was like this. At that time I didn't know you. I would have brought him for massage. But anyway, so we'll be looking at the benefits of massage. Okay. Is he here? Oh, he's actually here. We'll be looking at the benefits of massage, but let's talk about the types of massage we have.
Okay. So based on the civilizations of other countries, you know, where it started is Egypt. You know, and then the Far Asians also took it, you know, like the monks and everything. For so many years, they've realized that it's an alternative to maybe going to the hospital to be prescribed drugs and all that. So once it's a lifestyle, you do it on a continual basis. Nobody advises you to walk, but because it's a lifestyle, you walk all the way same. So countries like France, and then Hawaii, India, they all have their type of massages. We have Thai from Thailand, we have Ayurveda from India, we have, you know, Lomi Lomi from Hawaii, and then the popular one is the Swedish relaxation massage.
That's the only one I know. And then the deep tissue.
Deep tissue is even under Swedish relaxation, but it's all got to do with the depth at which the therapists apply into your tissue.
Ransford, we cover for anything.
You know, massages has to do with the organs in your body, right? And it's very funny that some of us in this area or in Ghana do not really acknowledge our sex organs. Okay. The purpose of massage is adequate blood flow or good blood flow to every tissue, the sex organs to our tissues. People are having issues with impotency just because they are unable to get the right blood to circulate in their piece. Do you get it? People are having low libido because the right blood is not going into their V's. So at the end of the day, if you are not really getting the right blood into your P and your V's, you wouldn't even have the desire to want to have coitus.
Okay.
Do you get it?
So that is the type. Okay.
Yes. Massage would help with all the systems in your body, which are of course about 11, 12, or 13. Respiratory, the digestive, the muscular, the skeletal, the cardiovascular, the nervous system, the immune system. All these systems, God in His wisdom, put it in our body so that they will function. And then the functionality functions with the organs, the kidney, the liver, the gallbladder, and everything. So if at the end of the day, the organs would require massage to help function well, and you think that, it's un-Ghanaian to get massages into Betrayama, will issue no about chronic, from acute state to the chronic, then it's up to you. Because for us, a few people are using us, and they are getting better results. But some people would be stubborn enough to wait until they are having mild strokes before they call us. When you call me at the time that you are having stroke, I wouldn't be able to help you like I would have helped if I was preventing it. So massage is a lifestyle to prevent diseases.
So you are saying it's a preventive measure and not the curative.
It does both. Okay, but you don't wait till it becomes worse before you'd want to fall on massages. Okay, I know we will be talking about depressions, but you see the thing with depression, the easier way is to prescribe antidepressant
In fact,
drugs.
we will come there because
Is English against depression.
Yes, we will come to depression. We'll come to depression. Can massage ever replace medical intervention, or the two must go hand in hand?
Medicine is medicine, and everybody that has studied will tell you they've studied so many years to acquire that doctorate to become a doctor. Massage is not supposed to replace anything. It's a lifestyle. Nobody tells you to walk or run or exercise. So definitely when you begin to get massages as a lifestyle, then even the issues that will send you to the hospital, like stress related conditions, will not even surface, because stress in itself is a decision you have to make. Whatever situation in which you find yourself, you have three choices, whether to fight it, whether to run away at it or from it, or whether to look at it head on. You get it? So we call it the flight, the fight, and the freeze responses.
Great. Since you're bringing that, I want to play an interview I had with you recently. Because you said that Funny Face, our own Funny Face, if he had come to you, he wouldn't have been in the state he finds himself in right now, right?
Exactly.
So take a listen.
As many times as he gets massages, he'll be able to sleep and sleep better. Yeah. And then he will leave the situation to the people that matters. Either God, the law, or...
Per Funny Face's situation, if it's really medical, like we are getting to know, is it not for him to go through the psychiatric treatment and get medication and all of that?
I don't even know why people are asked to go to the psychiatry in the first place.
Whoa, you are going to get yourself into trouble.
Yes, because what is actually of the mind can be cured with massage.
What kind of massage will save our Funny Face for us? Because we want him back.
Relaxation massage.
Tell us about that.
Okay, so you see, massages helps with all the systems in the body. Cardiovascular, immune, lymphatic, digestive system, the skeletal system, the muscular system. So whatever it is that he's going through, all he needs is, an in-house massage therapist who has a lot of shea butter. And then we'll be giving him massages maybe day and night, and that's about it.
And Funny Face will be fine.
Funny Face is already fine.
Bros, are you sure?
Whatever it is that he shows you is what he wants you to see. But if he's getting regular massages, he probably might not even shoot his anger.
All right. So, Ransford.
Yeah.
You are going to get yourself into some trouble here.
No, this is even going to skyrocket my trade, because
was it your voice I just played?
Yes,
which I know I record. Okay, so we'll come to our gentleman Funny Face, yeah.
Okay.
But what exactly is depression?
Okay, so usually I would like to ask to go to my book of Bible story and then begin to break it down.
My book of Bible story.
Exactly.
Hey.
You see, God created us, right? And he gave us mind and senses. Let's talk about the senses. We have the sense of taste, sight, hearing, touch, and then feeling. Okay, so the sense of depression is the sense of feeling is what the depressed people go through. The way they feel, the mood they are in, based on their life choices or based on whatever has happened. Mm-hmm. So the loss of a loved one, like if someone loses their mother or their father just because he or she is the breadwinner, now they are coming to think. Okay, so they put the mind, which is not supposed to think beyond their control, into overuse. They continue to think, and they continue to want to find results, and they continue to wish that their loved one who is deceased wouldn't have, Yeah. So at the end of the day, if you live beyond your mind control, you are putting yourself in a situation whereby nothing told you would make sense. So in the case of Funny, for instance, I believe he might have seen a pastor or a doctor or all the people that matters, but still ontie futu and I say the ekano.
It's not working
out for him because he's emotional. So God gave us cognition, emotional, and then motivation. What is really motivating him to go the trend he's going? Because he wants his daughters or his children back. Something happened to me, and then I began to really understand the situation in which he is. My wife and I had been married for 10 years. We didn't have a child. And on the day of going to the hospital in hopes she would be admitted to actually deliver, we were told that the child had died pressure they call preeclampsia.
That's right.
Okay. This is someone
very
after 10 years.
Sorry to hear that.
Don't worry. I mean, ignorance, so we go through these things. This is someone who had actually carried a baby after not having that child for 10 years, only to lose it at the latter part. So, and to wada, inti atomedan inti minimiti said there etie. Wohu, ni situation no okumuno. And then I make us massage bit me abua because the more he gets massages, the more he's able to release all that tension that is actually skyrocketing in his head to do the things he's doing. What he's doing to the people that does not matter now are not in that situation. They will think, say, I am collaborating. So what did they make and I say? And I make and say, I do not need my body need bread. But someone would have to be with him to constantly remind him of the fact that say there is a certain tomorrow, and then he shouldn't actually allow himself to be carried away by the situations. And that is eating well, especially getting massage and light soup.
The light soup and your share, but I'll come there. But are you saying that the work of a psychologist in Funny Face's case wouldn't work without the massage?
It works, but then the person that is the patient must listen. And the person that is the patient must also make sure, say, he listens to the man that even created him and said, say, I've given you all these senses, but if you're unable to control it, come back to me. Cast your burdens upon me, or come all you who are heavy laden, and I'll give you rest.
Done, brother.
No. You see, if you don't put your hopes or your faith in God and hope that He would fix certain situations, and you want to use your wisdom to want to do it, it wouldn't work.
So for you as a massage therapist, Funny Face comes to you because all these talks will not happen. What he's coming for is a massage therapy from you.
Exactly.
What would you have done to Funny Face for him to come back?
Give him a regular massage. It's a mind, body, and spirit issue. That is what God gave us.
Well, do you use spirit to do anything when you're massaging?
No, the soul, your body.
The person.
Yes, the soul of the person is in a higher state, in a higher realm. It is supposed to actually lower. That is why massage helps with lowering your blood pressure. Funny blood pressure, skyrocketed to a state where because of emotions.
But we wouldn't know.
So
about
if you don't have that cognition
right?
to understand that your psychologist and your psychiatrist are telling you that calm down for your own health, you wouldn't calm down. And to everybody that has that acumen and has the knowledge to help you bring your own body to homeostasis where you are calm now usuntia sana bebano inti massage or your regular massage to say bia mena menene fie ana meyen massage anka bibia befa.
So how regular is the regular massage that I'm using Funny Face because we all know his situation, exactly. Unfortunately.
Sure.
How regular is the regularness of the massage he needs and anybody who might be in such a situation?
Okay, so cortisol is the reason why this hormonal we become so hormonal.
And then cortisol.
A stress hormone. Cortisol.
Oh, okay.
A stress hormone.
Can you spell CORTISOL?
Okay.
Oh.
There are other hormones, okay, that propel us to win, like dopamine, serotonin, and endorphins. So imagine, say, cortisol is just one bad hormone, but there are other 3 good hormones. So what you have to do is to get the 3 good hormones circulating in your body, and then it will balance your systems and then your organs. Do you understand? maybe this is not a night show, so I wouldn't go there.
Please don't go there.
I wouldn't go there. You see, so if your hormones are not balancing, definitely, because stress is a decision, you make bad choices. That is why I said in the video, when he is not recording himself to let people be sympathetic about him, what do you think he's going through at that point in time? There are times that wherever he is, he is happy because he's been able to calm himself down. But when the issues escalate and he gets information and he's unable to take that information or absorb it, then he wants to react and to also let the public know where he is. So all we see is that he's making,
displaying
a joke out of himself, which is not. It's just that he's depressed.
Recently, there was a story of a gospel singer who just killed himself. After going through 3, he said he had 3 surgeries in the testicles and all of that, plus other things, and he felt he had failed and had failed the church. And so he recently, just within the week, he killed himself. Such situations, suicidal thoughts linked with depression and stress. Where does massage also come in?
Okay, so people who think that life is not worth living, even if they are rich, they are not sick, are also part of the whole situation. You see, your thinking, that's the mind. The way you think, would have to be, checked. What goes through a person's mind when they are very quiet. Some people can be very lonely. Some people could have been in certain traumas whilst they were growing up. Sometimes even as we speak, I, together with about 50% of Ghanaians, are in financial difficulties. I together
and massage can remove the financial and because
it will help you relax. You see, solutions to them.
Now, Ransford, I come to you for massage, okay? Yeah. The problems on my head are big.
Yes.
Okay? Yes. It's not just like somebody who is the problems, so he will forget for a while.
Yes.
It's not the same as the massage because you massage the person.
You see, for those that really fall on hard stuff like alcohol and drugs, that is not the way to go. Okay, alcohol and drugs wouldn't help all the systems in the body and the organs. Okay, then you would take the alcohol, drugs, and eat and then be obese and stuff like that. But at the end of the day, you would be putting strain on your lymphatic system to push those toxins out of your body. If the toxins do not leave your body, they will become tumors. Do you get it? So it's just that everybody listening to me would have to know that massage is the the optimum lifestyle to preventing diseases, and also even if you are in the that realm where you are sick, it helps you relaxes and it helps the blood to flow, and then you can make sound decisions and also sleep better.
Great. My question is, for how long does the effect of your massage on me right now alleviate my stress level against tomorrow?
Okay.
That's why I linked it to drinking, because some people will drink to forget their worries for a while, and in the morning the problem is staring at them.
Yeah.
So for how long will it benefit me?
Okay.
Is it going to help me so that tomorrow I would have improved?
Some people can actually, tell the benefits of massage that they continue to feel good for 7 days, 2 weeks, 1 month.
Wow.
Sometimes, even when you remember how you were touched, even in the massage parlor, just the imagination puts you into that state of feeling good. Yes.
Even the deep tissue massage?
Even people would watch my massage videos and still feel good when they've not been touched.
Some kind of way.
I've done so many therapeutic videos and other sensual ones. Okay. So however you come across my video, say, no, this therapist is a very good therapist. And even the way he's working on the patient that is lying and receiving it crying, makes you even feel better. So everybody and how they benefit from the therapy, and because it's cost, if it comes at a cost, So we would say maybe get massages once a month, or once a week, or once a fortnight. But then you can get massages every day, once every day or twice every day, depending on your capacity to pay.
So one will not be having too much of massage.
No. There is nothing like too much massage.
Really?
Yes. You can get massage in the morning, in the afternoon, in the evening. Okay, because your body is going through a lot. And at the end of the day, if you are able to relax after every massage, then you are not really hyper. So the mind is in a state where it's peaceable. That's or right. is very harmonious, and you don't think what you're not supposed to think and all that.
I wish we could go on and on, but very quickly, what are the illnesses? You've mentioned a few. What are the illnesses? Is it sciatica and so on, so that if somebody is diagnosed with, they could massage their way out, partially, if not fully? Okay,
so mentally, all the mental disorders, anxiety, depression, insomnia. Insomnia is your inability to sleep better.
Or to stay asleep.
Or to stay. Okay. So, and then the physical. You see, whilst you are working or you're sitting behind the console, at the end of the day, you're moving and then coming back. So you might have wrong posture. You can have massages to help with your shoulders, your neck, and even your head. Even massage helps with migraine, and it helps people with pregnant women with edema and all that, or pregnant women with back pain.
What is edema? That's the back pain?
No, edema is more or less like retention of water at certain areas of your body where the lymph is unable to push those toxins out of your body. Do you get it? So what you probably wouldn't use massage for would be high fever.
Why not?
Because of maybe your temperature and the fact that maybe you might be able to react to massage in a certain way. But even in my practice, I worked on 3 Chinese men who traveled all the way from Domain Crew to Accra, and they had serious temperature where I shouldn't have even meted massage on their bodies, but it's got to do with the pressure you dip in the person's body. And even though they're in the book, we call it contraindications, that when this person is this, you don't do this. I have been able to do that and still got results. Yes.
What finally, really, because we have to go, unfortunately, what have been your highs and lows as far as massage is concerned? What are your successes? Mm-hmm. Like you just mentioned that people came from China or wherever. Yeah. What have been your successes just to convince me to do massage?
Okay, it's got to do with perception. Okay.
What have been some of yours? For instance, somebody had a stroke and I massaged him or her to be slightly better than the situation was before. Things like that. Just quickly,
yes,
a minute.
There are many in that situation. Even people that are aging, that are supposed to receive massages on a normal basis to sleep better and all that. I have done massages for them and their conditions have improved. There are people who had mild stroke, and based on the fact that they added massages as part of their recovery process, they've been able to recover. It is not right for us to sit here and be telling people about what I can do and what I cannot do, because healing in itself comes from God. That's just right. That we have the knowledge to help the patient, who probably will conform to our knowledge to also heal through faith. But at the end of the day, my problem with Ghanaians is the perception they have about massage, thinking it's un-Ghanaian and it's not their nature, but then they will wait until the issue becomes chronic before they want to fall on us.
Before they come.
Yes, okay. The earlier you begin to use massage as a preventive other than curative, the better it becomes a lifestyle. And whilst it's a lifestyle, you know the benefits of that lifestyle, and then you live to become as old as God has actually destined.
And therefore, massage should actually become a lifestyle and not just, a curative measure, running to see daddy when you're hungry.
You don't have to be in pain to get a massage. You don't have to be sick to get a massage.
Absolutely. Well, I'm sure Ransford Afari, we will have to bring you again to look at different variants as well as far as massage therapy is concerned. And of course, other related issues.
I'm really humble and thank the station for inviting me.
Thank you very much too for taking time off your busy schedule. Well, I've been speaking with certified massage therapist and CEO of Ransford Spa in Adenta. His name is Ransford Afari. He's been talking about the link between depression, stress, and massage. Thank you so much for coming. And this is where we draw the curtain also on the brighter side on Z101.9 FM. It's been an amazing time enjoying great music as well as great conversations. We will definitely continue this conversation some other time, but thank you so much. Don't forget to make a date with the King of Country, Tommy Annan Forson, tonight